If you've had concussion or a brain injury, you're in for a treat because today Dr. Ayla Wolf will tell us about how you too can recover from concussion and brain injury. And what's so special about Dr. Ayla Wolf is that she's a highly respected specialist in neurological rehabilitation, recognized by her peers and sought after by patients for her expertise in complex neurological disorders, including persistent post-concussion syndrome. And she's the founder and clinic director of Healing Response Acupuncture and Functional Neurology in Lake Elmo, Minnesota, and she integrates advanced clinical neuroscience with holistic therapeutic approaches to deliver comprehensive patient care. Dr. Ayla, tell us about concussion and brain injury. Why did you focus on this particular topic? Did you have a concussion or brain injury yourself or someone in your family?
Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
Yeah, this was definitely something that I dealt with personally, and I think in hindsight, when I was having my post-concussion symptoms, I didn't even know that my symptoms or what I was struggling with were related to my concussion. The reality is that there's definitely a percentage of people that fall into that camp. And so we could maybe split people up into saying some people have, say, like a car accident or a slip and fall or a sports concussion, and they immediately have symptoms and they know they had a concussion, and then they have kind of the aftermath of that and the process of healing. Then there's another group of people that maybe have had injuries that they were able to walk away from, and they maybe didn't think it was so serious, but then over the next 6 months, they develop all kinds of symptoms, maybe difficulty focusing, difficulty concentrating, maybe they feel more depressed or irritable, they feel more overwhelmed easily, maybe their sleep gets off and they start sleeping poorly. And they don't even recognize that these are all symptoms of a concussion that they had that they didn't recognize was as serious as it was. And so I think that because that was my experience, I've had so many aha moments over the years of recognizing all of my struggles really led right back to my long history of multiple sports concussions. And because I was always able to walk away from them, it just, in the moment, I never recognized how serious it was. I didn't realize I had had that concussion until, in hindsight, I looked back and said, oh, wow, all of the stuff that I'm dealing with traces right back to these concussions. So I think what a lot of people don't recognize is that we take our brains for granted. And so many of the things that we do all day long require normal brain function, and we just assume that that is always going to be there for us. And when we lose that, it can be, just so challenging because our brain is controlling our hormones. It's, controlling our mood. It's controlling our ability to focus and concentrate and make decisions all day long. It is, our autonomic nervous system controlling our heart rate and our blood pressure and all of these different autonomic functions that we never have to think about. As soon as all of that goes off the rails and starts becoming dysfunctional, people's lives can really get thrown way out of balance. And it can be quite a process to figure out what even is the first step to healing, because everybody's concussion and brain injury can manifest completely differently.
Thank you. Tell us, what can someone do once they discovered that they had a concussion or a brain injury? What are the general steps for someone to heal?
Well, we could talk about kind of the acute circumstances and then maybe get into more chronic. So if somebody has had a fall or a car accident or some kind of injury where they hit their head and they have immediate symptoms, whether that is dizziness, nausea, headaches, maybe poor balance, changes in vision, it would definitely be a good idea to go to the emergency room and get checked out by a neurologist who can perform some neurological exams and determine whether or not they want to order a CT scan. Those CT scans are meant to determine whether or not there's a skull fracture or any kind of internal bleeding. They're not definitive in ruling in or out a concussion. So that's also where I think there's a lot of confusion, is that when people do go to the emergency room, when they do get a CT scan, if that CT scan is normal doesn't mean that they didn't get a concussion. Normal just means that they did not fracture their skull and there's not any internal bleeding that's showing up on the scan. And so I think a lot of people are told, well, your scan was normal, you've had a concussion, and you should follow up with the doctor within the next 30 days. And at least in the United States, the statistics say that when people are told to follow up with the doctor after their concussion, over half of the people don't. And so that's also part of the problem, is that I think people don't recognize the severity of a concussion and what that can lead to. There's a certain percentage of people that over the course of 30 days will be able to heal and their symptoms will go away. But then there's, anywhere from like 30 to 50% of people who after their concussion, they will go on to experience persistent symptoms. And whether those are physical symptoms like headaches and neck pain and dizziness, or they might be cognitive symptoms, like I mentioned earlier, with the difficulty focusing or concentrating or just having trouble staying organized or making decisions. And because those cognitive symptoms are maybe a little bit more subtle or hard to pin down, I think some people, again, don't recognize that that's because of the concussion that happened 2 weeks before. But so in the acute stage, it's very good to go see a doctor, to get evaluated, to rule out whether this is a more severe TBI or something that needs immediate emergency medical attention. And then after people have been told they've had a concussion, they're usually referred, like I said, to a neurologist or to their general practitioner, who can then send them to a neurologist. This is where the medical system, I have to say, struggles, because of the fact that people's concussions can manifest very differently. And so that's where I wrote a book that helps people to categorize their symptoms, because when you can categorize your symptoms, it helps you to figure out who to turn to for healing. And so this is what this podcast is all about, right? It's about healing. And that can be a very confusing process for people. And so in my book, I broke it down into several different categories of symptoms. And so the first category is post-traumatic headaches. And the post-traumatic headaches can be complex because they can appear to look just like migraines. And yet, if they're not a true migraine, they're not going to respond well to migraine medication. And so many people can spend months to years being prescribed migraine medication for their post-traumatic headache and not actually get relief. And then they can develop medication overuse headaches because they're maybe taking migraine medication, it's not helping, and so they're supplementing with ibuprofen or other over-the-counter pain meds, and then that can snowball into a situation where they now have almost daily headaches as a result of a medication that's not working, and then them supplementing with other over-the-counter pain meds that then causes them to have these rebound headaches. So getting the proper kind of diagnosis of what type of headache people are experiencing is very important. Then we have a whole category of neck injuries, because by the very nature of somebody hitting their head, their neck is often involved. And so when people have trauma to their neck, that alone can cause dizziness and nausea and poor balance and headaches. And so some people will have what's called a cervicogenic headache, where the headache is actually stemming from the neck injury. And so recognizing the importance of treating the neck is huge. And so whether that rehab looks like working with a personal trainer or a chiropractor or an acupuncturist or a very skilled body worker or somebody that does kind of hands-on osteopathic work, all of those hands-on therapies can be very helpful for helping somebody to heal their neck injury, which then in turn can often alleviate a lot of these other symptoms that kind of fall into that post-concussion symptom category. And then there is the autonomic nervous system, like I mentioned earlier. And many people will have dysregulation of their blood pressure and their heart rate. So maybe when they try to go exercise, they develop symptoms. And so they develop an exercise intolerance. And when you're an athlete, that can be incredibly disruptive to your life if you have a concussion and you try to go back to your sport, and every time you try to exercise, you get nauseous or headaches or severe debilitating vertigo or whatever it might be. And so learning how to recognize some of these symptoms related to the autonomic nervous system is really important. And I break all that down in my book. So I have many different kind of symptom categories and lists in my book where people can go through these checklists and ask the question of, do I maybe have autonomic dysregulation? Because if so, then they need to be able to work with some kind of either neurologist or therapist, like a functional neurologist who understands how to kind of rehab that autonomic nervous system and retrain it. So that's another kind of category. And then we have all the cognitive symptoms, like I'd mentioned. And then what can often get missed is the role of your eyes. So when somebody gets a concussion, it's very common that they develop eye movement disorders, where, typically when we go to the eye doctor, they check our visual acuity. They show us that chart on the wall, say, can you read line number 5 on the chart? And if you can read that, then your vision's 20/20, or, whatever it might be. So people are very much used to having their vision assessed in terms of visual acuity. But what happens with a concussion is their visual acuity might be the same. Maybe that hasn't changed, but the way that the two eyes are working together is now dysfunctional. And so that can create all kinds of symptoms coming from the visual system, where every time somebody gets on a computer or tries to read or tries to drive, their eyes are struggling, and that can cause a lot of headaches and dizziness and nausea and neck pain and the like. And so if the eyes aren't being appropriately assessed as part of that neurological exam, that can get missed, and it can get missed for a very long time. So that's another important thing, that if people are having a lot of visual symptoms, or as soon as they get in front of a computer, they become symptomatic, it's really important to seek out, say, like a neuro-optometrist who can appropriately assess their eye movements instead of just looking at kind of a basic eye exam that might focus more on visual acuity. So that's another people can explore. So then we have our vestibular system, which is actually hardwired into our visual system. So when we have vestibular dysfunction, so the vestibular system helps with our balance, and we have inner ear, we have these different kind of very sensitive and delicate apparatus that determine how our head is moving and kind of the speed that their head is moving, how it's tilted, how it's turning. And again, this is something we take for granted until it stops working. And so when the vestibular system is affected, people might have more disequilibrium, poor balance. They might have actual vertigo where they feel like the world is spinning, but also very commonly they have these, what we might call like non-spinning vertigo symptoms, where maybe they just have this sense like they're on a boat, like they just kind of feel like they're rocking or swaying or bobbing, and they feel off. And that, again, often gets misdiagnosed, or it kind of gets glossed over as not being important, when it's actually very important, because our ability to know where we are in space and how we're moving through the world is essential for us to feel safe in our own bodies. And so when that is off, people can develop a lot of fear, a lot of anxiety, a sense of panic, and a sense of not being comfortable in their own skin, or not being able to trust how they're walking or moving or navigating through the world. That can also make it very hard to be in vehicles like cars, buses, trains, can cause a lot of symptoms. So when people are having those kind of symptoms, it's very important to seek out some kind of therapist who really understands how to do vestibular rehabilitation and how to do a lot of integrative therapies that understand that our vestibular system in the inner ear all of that information feeds into our brain, and the brain is integrating it with our visual system and with our neck and our proprioceptive system. And so these systems all have to communicate with each other, and they have to kind of be saying the same thing to the brain. And if they're giving the brain a sensory mismatch, if my vestibular system is saying one thing and my eyes are saying a different thing and my neck is saying something else, well, then all of a sudden I have this complete sensory mismatch in my brain happening, and I don't know where I'm at, and I don't know how to move through the world without feeling dizzy and nauseous and almost like I'm not part of the world. So these sensory mismatches can actually create a sense of disconnect from our environment, and they can, again, just cause a lot of emotional symptoms and make it very hard to function in life. So the thing is when people have a concussion, like I said, everybody can have their own unique set of challenges, and they have to understand how to trace those symptoms back to these different systems in the brain so that they can find the right therapist and the right kind of hands-on practitioner to help them rehab their unique set of challenges. And that can be hard to find people, in your area that have those skill sets to look at the big picture and then evaluate somebody individually and come up with that individual treatment plan.
Thank you. My mother was hit by a car about 20 years ago. And I remember that it took her some time to recover, and she did have brain injuries, minor ones. And I remember her never being the same after, in the sense that she used to be a very sweet mother. She used to be she's still very kind, but she was very sweet. And then she became like this general, very snappy person, it's almost like overnight she became very anxious and almost like she had no time for like anyone to actually say what they were going to say. She would like always interrupt. Would you say that's like a common thing that people tend to get, to become like a lot more anxious, a lot more snappy, a lot more irritated by minor things? And if so, what would be the treatment for that?
Those are very common symptoms. And I work with a lot of women that have had concussions and brain injuries, and a lot of women that have children, and they feel very guilty because they come into my clinic and they say, I used to have so much more patience with my children, and now I'm snapping at them, and I'm irritated all the time, and I feel bad about it because they don't want to be that way. We have to bring this back to a little bit of neuroanatomy, so bear with me. We have in our frontal lobe, we have what's called the prefrontal cortex, and this is kind of like the CEO of the company. The prefrontal cortex gets to make all the decisions and do all the planning and all the strategizing. And so that part of the brain is very commonly affected by concussions and brain injuries. And one of the roles of the prefrontal cortex is to inhibit our limbic system, which is kind of our emotional brain. And so if one of the roles of the prefrontal cortex is to keep our emotions in check, and then we lose that function because of the concussion, well, now all of a sudden the limbic system kind of gets to run the show, and that's then where you're seeing this inability to be patient and be kind and to have the level of patience that a mother needs with their kids. And so you'll see this happen, and not just for women but for men too. But after a concussion, people will be more emotional. They'll be more easily frustrated. They'll be irritated. They might have more outbursts. They lose their filter. So that can show up where people might overshare information, or they might interrupt people when they're talking, or they just talk and don't quite know how to have a cohesive storyline. So they're just all over the place. So you see all of those symptoms that don't necessarily, it's not, like you said, you kind of felt like your mom's personality changed, and really it was her brain struggling to heal from the injury. And so that prefrontal cortex maybe was injured and never had the appropriate therapies to get back to where it was before, so that it could do its job of kind of inhibiting the emotional system, that limbic system, and keeping it in check. And so what you were seeing was one part of the brain struggling and another part of the brain getting to kind of take over. And then, people, like I said, they're more emotional, they're more impulsive, they might be more angry, they might have more outbursts. So that is incredibly common. And in terms of treatment, what often works best is not just to have somebody do like one therapy at a time, but to kind of stack different therapies all together. A good analogy I like to use is if you're trying to start a campfire, if you light one match and just hold it to one little part of the fire, well, you're not going to get the fire going as well as if you light 20 matches around the entire fire and you have 20 little flames that then all of a sudden you've got a roaring fire. The brain is kind of the same way. Our brain is constantly communicating, all different parts of it. And so if you're trying to get that prefrontal cortex working better, we might have somebody doing a certain exercise, an eye exercise that activates certain parts of the frontal lobe while we are having them balance on one foot. Or maybe we're playing distracting music that they have to ignore while they're trying to do their task. Or maybe we have someone doing an eye exercise while we're simultaneously doing some peripheral nerve stimulation or a therapy to increase blood flow to the brain using red light therapy or pulsed electromagnetic field therapy or acupuncture. So when we can stack different therapies that include improving blood flow to the brain, having somebody doing maybe different eye exercises or having them doing some kind of cognitive task while they're also moving or challenging their body in a certain way. This tends to get people better faster than if you just give them like one isolated exercise to do by itself.
Thank you. Tell us more about what else you would like entrepreneurs and people who have concussion or brain injury, what else you would like them to know about the available treatments?
Yeah, there's a lot of treatment options. And, I have a podcast called Life After Impact, the Concussion Recovery Podcast. And I get to interview a lot of experts in the space. And the thing that I hear over and over and over again is that when people have concussions and brain injuries, is that a lot of times pharmaceutical approaches are not very helpful. And so you can't really retrain a brain by just taking a pill or a medication. And a lot of this, and if you're just treating the symptoms, that also doesn't work very well. In terms of like if somebody has a headache, oftentimes just giving them pain meds doesn't help resolve the headache. Or if somebody has dizziness, you could give them meclizine, but that's really just meant to be a very short-term medication to kind of shut down a really bad episode of vertigo. And so a lot of these medications are not helpful when people have persistent ongoing symptoms. And so the thing I think that people end up hitting a lot of roadblocks in medicine because they'll go to different doctor's appointments, they'll be prescribed different medications, maybe those medications don't help. And then usually kind of the next step is the doctor might say, well, these medications aren't helping you. So why don't we just send you out to physical therapy? Maybe they can help. And there are certain people in physical therapy that are very highly trained to work with people with concussions. But then there's a whole field of physical therapists that don't necessarily have that specialized training. So if somebody ends up with a PT that maybe doesn't specialize in brain injuries, then again, they might, do some balance exercises or other things, and they still aren't getting kind of that individualized care that they need. So I say all this not to say that medication is bad or PT is bad. What I'm saying is that people are going to probably get better individualized care if they can find a specialist in whatever field that is. Whether it's chiropractic or Chinese medicine or PT, if they can find somebody who really has specialized training and advanced training in brain injuries and concussions, they're probably going to get a better experience because it is one of the most complicated injuries that somebody can have. And that's where if you're not working with a specialist, you might not be getting the right evaluations. You might not have somebody who's able to see that whole picture of how the vestibular system and the ocular motor and the visual system and the proprioceptive system, how those all need to integrate together. There's just a lot of things that can get missed if people are working with somebody who isn't concussion informed and hasn't taken the time to do a lot of additional training due to the complexity of the injury.
Thank you. What would you say most patients that have a brain injury or concussion do in order to recover? Is it the general thing that they just take pills and then kind of hope that the pain will go away? Or would you say that most people do seek out integrative, holistic treatments that kind of combined can bring like a better outcome? What would you say is the general opinion about what's actually happening right now in terms of brain injury and concussion patients?
It's a little hard to say because of the world that I live in, having a background in acupuncture and Chinese medicine. What often happens is when people find me, I'm kind of their last hope. And so when people get a concussion, I don't think that their initial thought is, oh, let me go seek out an acupuncturist or a chiropractor or a PT. I think a lot of people do end up going through kind of that, medical world first. And then usually they are prescribed different medications for pain or for nausea. And then sometimes they are referred pretty quickly to physical therapy. But by the time people come to see me, it's usually they've been struggling with their symptoms for months to years, and they've already seen a lot of other providers, and they're still symptomatic. So because of my background and my niche and my training, the people that kind of end up in my office are often people who have been struggling for a very long time, and then they somehow heard about me from somebody else. So that's why it's a little bit hard for me to answer that question because of kind of where I fit into the whole picture. But what I can say is that usually when people come see me, when I do have people that come to me literally within like a couple of weeks after a concussion, we often have much better outcomes, and we can get them better much faster than the person who has maybe just, been down a lot of other avenues for 2 years and they're still symptomatic. So it's like the sooner you can kind of get individualized care, usually the better.
Thank you. Tell me more about the impact of acupuncture and Chinese medicine and other holistic therapies on concussion and brain injury. What kind of results have you noticed for patients that you've worked with?
Yeah, so because I do a lot of objective testing, I have an app on my my iPad and my device that allows me to look at the pupillary light reflex, for example. And so the way that our pupils constrict in response to light is a very delicate orchestra between our sympathetic nervous system and our parasympathetic nervous system. And so I have an app that it flashes a light for 2 seconds and it records the pupil for 15 seconds, but it's taking 30 pictures a second and then spitting out this very high level report of the exact millimeters of the pupil and how fast it constricts and how long it stays constricted and the size of the maximum size, the minimum size. So I get a lot of objective markers from like a technology like that, as well as looking at using kind of computerized balance testing to use computers to actually measure someone's balance and their ability to close their eyes and be in different positions, say with, their feet together or one foot in front of the other. We look at their eyes. So I have goggles with infrared cameras that allow me to see what somebody's eyes are doing in the dark when they don't have anything to fixate on. And that gives me a window into how the vestibular system is kind of affecting the visual system, or if there's nystagmus, if there's difficulty moving eyes in a certain direction. I get to see all kinds of things when you put those goggles on. So by spending a lot of time on the front end and gathering a lot of information on somebody's motor system, how they're moving, on their sensory system, and how they're feeling, touch versus pain in different parts of their face and their body, by looking at gait patterns, by doing balance testing, by doing a lot of autonomic testing. I get to collect a lot of information, and then I can apply my acupuncture in a very precise way. So if I know that somebody had a neck injury and that neck injury is what's driving a lot of their symptoms, I can focus my acupuncture on improving the joint position sense of the neck. I can do acupuncture to help improve blood flow through the neck, to improve blood flow to the brain. Many people, when they have balance issues, they clamp down on their jaw. And so they walk around with a lot of jaw tension, which drives headaches. Acupuncture can be very useful for improving, or let's say reducing tension in the jaw and relieving the tightness in those muscles, which then have feedback loops into the brain that help to improve balance. And so I can really, through all of my investigation and my examination, understand an individual person's imbalances, and then I can target those systems very precisely with acupuncture. So in some cases, we might be doing more acupuncture points that bring blood flow to that prefrontal cortex to help with symptoms like irritability, anger, impulse control. And, you can kind of see people over the course of several weeks of getting acupuncture. They'll say, my mood is better. I'm not so irritable. I'm not so snappy at people. And so, like I said, by understanding each individual person's experience, I can use my acupuncture and change my treatment strategy, so that if I need to focus on the neck, I'm focusing on the neck. If I need to focus more on the mood and the emotions, and cognitive symptoms, I can do different points that improve that function. If I need to help with the autonomic nervous system, there are points that can help with that. So for example, we have these receptors in our neck called baroreceptors. And when we go from laying down to standing, those baroreceptors, they pick up on the fact that we just changed position and now we're upright, which means that we have to have a slight increase in heart rate and a slight increase in blood pressure in order to keep getting blood flow to the brain. And sometimes those baroreceptors, they're not functioning well after a concussion. We lose this kind of sensitivity to those. And by doing acupuncture and different therapies in the neck and the upper chest area, we can actually help to improve those baroreceptors so that people respond appropriately from laying down to standing up. So there's a lot of nuances to how acupuncture can actually be applied in all these different the kind of manifestations of a brain injury.
Thank you. Tell us about what you noticed for your patients. Have you noticed that the acupuncture and Chinese medicine and other holistic therapies that you have administered to your patients, have they worked? And how fast have they worked in terms of helping the patients to recover from a brain injury or concussion?
I find that when I work with people very soon after their concussion, they often heal faster. When people come to me and they say, my concussion was 4 years ago, or maybe they've had 3 concussions, and so we've got multiple injuries kind of stacked on top of each other, oftentimes we get symptomatic relief pretty quickly, but it can take longer so that holds, and that the symptoms, they might, people will say, oh my gosh, I felt amazing after my treatment. My headache was gone. My neck felt great. But then, 4 days or 5 days go by and my tension kind of crept back in. And so when people have had long-standing injuries, it's going to take more treatments for for them to have more long-lasting relief, typically. But we often find that pretty quickly people, they feel more alert, they feel calmer, their nausea is better, their neck pain is better. So pretty quickly people are reporting improvements in their symptoms. And then it's just kind of a matter of, how frequently do we need to treat them in order to get those improvements to stay and become more long-term.
Thank you. Tell us where entrepreneurs can connect with you and how patients that have concussion and brain injury can connect with you as well.
Yeah, so I packed a lot of information in my book, and my book isn't necessarily meant to be read cover to cover. It's kind of like a choose your own adventure for people trying to learn more about their injury. And so in chapter 1, there's a questionnaire that people can fill out. And then based on how they fill out the questionnaire, it tells them which chapters are going to be the most helpful for them. So the Concussion Breakthrough, Discover the Missing Pieces to Recovery is my book. It's available on Amazon. And then I also have my podcast, which is Life After Impact, the Concussion Recovery Podcast. And then my clinic website is healingresponseneuro.com. And so that's where people can come work with me in person. And I will, for people who are traveling out of town, I do have like a 5-day intensive option where people can, travel and stay in town and then get treated multiple times a day for 5 days. And that really allows us to heavily focus on, like one person's recovery during that time and give them a lot of time and attention. And so those are really great for people who maybe don't live in the, Minnesota area.
Follow me for more interviews with world's most innovative health changemakers to live your healthiest life ever.